It might seem like more people around you are getting sick, and it could be that COVID is back at the top of the list of suspects. A new subvariant is now the dominant strain here in the northeast U.S.
This seems so never ending. Our Abby Larico is with us with the fast facts on this fast spreading strain.
Hey, yeah, the formal name is XBB.1.5. The internet, though, is taken to calling it Kraken. It could be harder to figure out what to call this strain, though, than it is to catch the subvariant of the Omicron strain. So here's what you need to know about it with the help of some of these sources. XBB.1.5 has mutated to be able to better evade immunity than predecessor variants, according to Johns Hopkins University. That means you're more at risk of catching this variant, even if you've already been sick with previous Omicron strains, says the World Health Organization. And though vaccination still offers significant protection against serious disease, Johns Hopkins says it might not offer as much protection against mild infection. It's also extremely contagious, says Vanderbilt infectious diseases professor Dr. William Schaffner. An article in the scientific journal Nature explains it's better at entering the respiratory system. So far, though, XBB.1.5 doesn't seem to make people any sicker than other Omicron variants, according to this American Medical Association article. Illness is still typically milder than infection with the Delta variant, meaning, according to the Global Vaccine Alliance, it's more cold-like than flu-like, especially among those who've been vaccinated or have already had COVID. So looking this morning at the data here in Washington, D.C., the current COVID-19 community level in D.C. is low. That's a good thing, but here's why you still want to pay attention to what this variant is doing. Looking over at the CDC's COVID data tracker for variants in the entire country. Right now, this is the U.S. data. And Josh, let's zoom in right over here where you can see this XBB.1.5 variant. Look how quickly that's growing to make up a bigger percentage of the number of cases. Zooming back out just so that we can go check in on this northeast region that includes the DMV here. Take a look at this. We already are seeing XBB.1.5 make up about 50% of total cases, and look how quickly that's grown week to week. Something to keep an eye out for. And a reminder, masking, distancing, washing your hands when appropriate still works.
Going back to the basics, Abby, thank you so much. I agree with that. And yeah, I just got back from being out last week.
And I'm glad you're feeling better, friend.
Thank you.
Yeah.